Hello and welcome to CIBER Focus, your source for international business information. My name is Tim Smith and our guest today is Dr. Marcelino Feal. Dr. Feal is an experienced surgeon from Cuba and has been teaching medicine for 33 years and has published numerous textbooks and papers. He has also served as a war surgeon in Nicaragua for 2 years. He is a member of several leading associations, including the Cuban Society of Surgery and the Latin American Federation of Surgeons. In addition to practicing medicine, Dr. Feal is an accomplished writer, having written shows for TV, radio, movies, theater, and cabaret for 39 years. In today's episode, Dr. Feal will share his insights and experience of the Cuban public health care system, which is often considered a model of excellence and efficiency despite limited resources. Dr. Feal, thank you so much for coming in today.
It's a pleasure to be here. Thank you very much for the invitation.
Oh, el gusto es mío, señor. Muchas gracias. To begin with, could you give us a brief overview of what distinguishes the Cuban healthcare system from counterparts in other countries?
We have 3 levels of health attention. First level is what we call the family doctor. It's a doctor who lives in a neighborhood and he's supposed to attend and to know everything about 2,000, 3,000 patients in that area. All the minor diseases, he can solve them easily. And after that, you have the second level. The second level are the general hospitals, like mine, for instance, where you have all the specialties. And then you can solve some other problems a little bit more difficult than in the first level. And then you have patients admitted to the different services of the hospital. And apart from that, you have the third level. The third level, they are very specialized hospitals, and they are also doing a lot of researches. And for instance, you have the Neurological Institute, the Heart Institute, the Kidney Institute, and so on. Those are the 3 levels of our attention. You can go to the first level, to the second, or to the third, because it's free. And sometimes it's a problem because patients who can solve their problem in a certain level, they want to go to the next level. And sometimes the same patient asks for a first, second, third, and fourth opinion, and it shouldn't be, because sometimes they try to hear something different, and so they go to different places. That's, in general terms, our medical attention.
Yeah. Thank you. So could you tell us a little bit more about how the Cuban system of medical education, research, and international collaboration have helped build the healthcare system into what it is today?
I think we have joined schools from many places. And for instance, our semiology is very similar to French school. And we have a lot of things from USA, of course, because we are too close. And I think the main thing in our education system in medicine schools is that students from the very beginning, they have practice. They are in the hospitals, they are in the ORs, in emergency rooms. They are learning in practice. Some other places, I know, they are only in classrooms. In Cuba, you of course, you spend part of the time in classrooms, but every day you go to see patients, you go to the emergency room. When you are in surgical specialty, you go to the OR very often. In spite of you are not going to be a surgeon, no matter, you have to learn. So I think it's a very big difference with other places. Our percentage of practice that, for instance, we receive students from many places, but we also receive students as a way of interchanging experience. For instance, in my group, I receive students from Germany, from Le Charité, and they go to a contest to see which student is the selected one to go to Cuba to study surgery, not as a specialty, as a subject in the career.
Okay.
And they fight for that because they also, well, they want to know Cuba. Cuba is a beautiful place, and so you see, we receive students from many places. We receive, for instance, this last group I had now, before coming, there were a lot of African students, and they are in the, you call it Latin American students, but you see, there are, I remember students even from Vietnam and, well, many places.
Okay, thank you.
It's interesting for us and for our students because they talk, they learn together, and they spend a lot of time because in Cuba, studying medicine is 6 years. A career is a lot of time, and some of them, they have to come a year before to learn Spanish.
Okay, interesting.
Yeah.
Thank you very much. So what are some of the opportunities and challenges facing the healthcare system, and how do you think the recent political and diplomatic trends between Cuba and the U.S. will influence the system?
It would be very good for both sides because we can learn a lot, but maybe USA will buy some products we are producing in Cuba, excuse the repetition. For instance, Iberprot-P is a product that is considered the only product in the world to treat the diabetic foot. And Cuba is selling this product all over the world. And you have here, unfortunately, in USA, you have a lot of people here with obesity, with diabetes, and it would be very good for them to get this medicine. So I think any improvement in our relations would be good for everybody.
Absolutely, I agree. Thank you. So clearly, you're not only a successful surgeon, but also an experienced writer. How have you been able to combine these very different roles as surgeon, teacher, and writer in your career?
Well, it's something I can't give you the formula. I can tell you when I first became a professional writer before being a doctor. When I was a student of medicine, I was already a professional writer.
Okay.
And it was a problem in my family. Because I said, well, explain me. You are studying art or you are studying medicine. In this family, everybody's a doctor, says, and we do not have artists. So you have to decide. But the years began to happen, and then this family, my mother, she was very happy when she saw my name in the TV, when she heard my name in the radio. And so I said, well, things are coming out. And nowadays I try to do both things. Anton Chekhov, the famous Russian writer, used to say, he was a doctor and he was a very great writer, and he used to say that medicine was his wife and writing was his mistress. And when he got tired from his wife, he went to the mistress, and so he was changing from one side to the other. I'm not Chekhov and will never be, but I always remembered this phrase of him.
Excelente.
Yeah.
Muchas gracias. Well, Dr. Feal, thank you so much for coming quite a distance to be with us today, and I appreciate everything you shared with us. I wish you safe travels.
It's a pleasure, and really it has been a great experience to be here in Bloomington.
That's all for this edition of CIBER Focus. Thank you for tuning in. If you have any comments or suggestions for future topics, please let us know at CIBER, that's CIBER, at indiana.edu.